Focus arose out of my own frustration as a physician trying to take care of patients with ADHD and as a father living at home with 2 children with ADHD. It's really been a journey over about 10 to 15 years of experience in living ADHD at home and then trying to address it with my patients in our practice. And that experience led me to realize that there has to be a better way to diagnose and treat this disorder. Now, one of the things that we tell patients all the time is you have a great brain, but it's not the pay attention kind. Well, how do we figure that out? You know, traditionally in the ADHD world, you really have 2 choices. To go to a physician, maybe get 5 or 10, 15 minutes with that doctor, who then may rush to a judgment that this is ADHD, and parents truly fear that with good reason. The other side of the coin, though, seems a little bit belabored. 50% of ADHD patients don't have any learning problems apart from their ADHD. And the other side of the spectrum belabors the point with psychological and educational testing that it's certainly, almost certainly not needed in a number of cases. And so what we try to do at Focus MD is to provide that time to arrive at an accurate diagnosis that's neither hurried nor do we drag our feet, and we come up with an approach that sounds reasonable from a medical standpoint, and more importantly probably an approach that sounds reasonable to the family. Parents are understandably wary about giving their children medication that they fear, to be quite honest. And there's a good reason. We hear the horror stories of stimulant medication every day at Focus. And our pledge to our patients is that we're not going to participate in zombifying their child or altering their personality, because our patients are really fantastic, creative kids who don't pay attention well and wind up suffering because of that. Parents should always feel comfortable in this setting to ask the question, is my child having problems with ADHD, knowing that that question will be taken seriously and considered thoughtfully, and no rush to judgment will be made. We engineered the practice to have time to be able to spend with our patients, but we also offer cutting-edge technology in our testing. That testing allows us to have a better chance of getting the diagnosis right from the beginning at the first visit. The office visit at Focus has been designed not to rush things, but to be efficient and mindful of everyone's time. So we have time to get to know the patient and even let the child have some time to play Legos so we can observe their behavior, do our testing, and also to give the parents time to express some concerns when the child's not in the room. We can wrap all this up in a single office visit and usually have time to discuss the results of testing, and the patient can leave feeling confident of the diagnosis and that a thoughtful treatment plan has been established.